Hey, come help.
Lucky we got an EMS professional on site working out. Okay, so what's the issue? Let's look at your ankle first, try to get a basic of the situation. Okay, this is George here. Is there any allergies we need to be aware of? So no allergies, okay? What about past medical history? Does he have?
He has diabetes.
He has diabetes,
Type
okay? So is he on any medication for that insulin, I assume?
Yes.
Okay. So we have past medical history, we have the medicine he's on and his allergies taken care of. When was his last meal, you know?
He didn't eat breakfast this morning.
Didn't eat
So
breakfast. So he probably has very low blood sugar right now, okay? So skip breakfast, he only ate last night. It's like, what happened?
He was just running up treadmill and fell off.
Okay, did he just like fall or?
He may have hit his head and hurt his arm.
Oh, really?
Yes.
Okay. So let's go through your airway, make sure your vitals are good, okay? Alright, so looks like he's breathing correctly. There's no stridor. There's no wheezing. And his respiratory rate. I'll just keep track how many breaths he takes in the course of a minute. For the sake of the video, we'll assume a minute has passed. And he was at about 23 breaths per minute, which that is slightly elevated, but we would assume since he was on the treadmill working out that his ventilation rate is going to increase. Okay. So next, also his chest is rising and falling pretty equally, so we can rule out hyperventilation or hypoventilation. Like more of an inhale or more of an exhale. He's got pretty even inhale and exhaling right now. In terms of circulation, we need to check his radial pulse in. I'm going to do this for a minute. Also, for the sake of video, we'll just assume a minute has passed. And he has a slightly elevated heart rate. He's about 120 beats per minute right now, which isn't it's pretty expected. He just got off the treadmill, just a couple minutes ago from running. So honestly, that's not too elevated, even though 60 to 100 would be considered normal, but because he's exercising, it's okay. And his skin color, he is slightly pale. This could also lead to the low blood sugar that we're diagnosing. And slightly ashen. And although this doesn't seem too severe right now, this could progress to blue if it was a very bad case of hypoglycemia. Okay, so George, how you feeling, buddy?
I'm a little lightheaded, kind of dizzy, but other than that.
Do you feel with it, or do you feel out of it, like mentally?
No, not too much.
Where are you, do you know?
Yeah, I'm at the LAC.
Okay. Anything else, like?
My wrist hurts a lot,
Okay, so did you catch yourself on the way down?
yeah, I was trying to catch myself and I kind of heard a pop whenever I landed on it.
Okay, so obviously George, he seems a little out of it. This can be explained due to like lack of glucose from not having breakfast, so there's no glucose getting to his brain, which is the primary fuel for people. Unless he's keto adapted, but he's not a ketogenic athlete, so that's a tangent. But and his speech is a little slurred, so this again points to hypoglycemia. Okay, and so we're gonna just look at his body. He's pretty exposed because he's wearing gym equipment. But I'm gonna kind of examine just his midsection for rebound tenderness, rigidity of the internal organs. Just make sure there's nothing going on there. And feeling around, kind of, we got the upper quadrants and the lower quadrants. Here we got the liver, we got the spleen, and we got the kidneys down here. And does any of this hurt, George, when I'm palpating?
No.
What? Just your wrist, right?
Yeah.
So, kind of move on and start treating your wrist. Could you do me a favor and go get the safety, the first aid? Okay. Oh, and it looks like you got a little cut here. Okay, so just try to keep this as, just try not to move that, okay? So you get a suspected fracture. You doing okay, or are you feeling a little?
Yeah, okay.
You're okay?
Yeah.
You sure? Okay. We're going to take you through, buddy. Alright? So we're going to apply this gauze and apply pressure on the wound. Should stop the bleeding. Okay. And we're just gonna wrap this, and let's try to support. Actually, it was your right arm that you broke. Right?
This one hurts.
Dude, be careful. Don't hurt yourself. So we're just gonna wrap over this, apply some pressure to keep this from bleeding. But this is probably the least of our worries in this situation. So we're gonna take care of this little bleeding, and then we are gonna move on. Okay? And for that, I should have put on these gloves. But I was a little anxious to help George out. So always at home, put these on first. When you're in a line of action, you can sometimes forget these things. Okay, so let's treat this wrist. We have a little slight deformity, it looks like. So we're going to splint it up, and we're going to get you to an ER as soon as possible to get some x-rays, okay? Apply that splint, just keep yourself. I'm going to try to lift you up a little bit. You got this, and this is going to keep him from supinating and pronating his elbow to keep that wrist intact as well as possible. And now we're going to try to wrap this. Okay? When you wrap about half of the, overlap about half. When you do this, just you're fine, buddy. That's good. You can put your elbow back down. Good, got you. We're getting you immobilized. And I also want to make sure we wrap up above the elbow so that the rotation, pronation, supination does not occur. And could you grab like a blanket or something? Also, to minimize shock just in case, because this is a pretty traumatic experience for old Georgie boy. And also, something I should noted when we expose a patient is he was sweating, and that's just common. He was working out, but also that's also common in hypoglycemia. You get a little shaky, you get a little sweaty, and it's just not a good thing. George, just make sure you eat a meal next time, buddy.
Okay.
Save yourself a risk, but you're gonna be okay. Dr. Gupta, a little arm and hand, they can take good care of you.
Sounds good.
We got you all wrapped up and good to go, my man. EMS should be here soon to take you. Would you want an ambulance, or would you rather probably drive yourself and save some money? That's what I would recommend.
I could have my friend drive me there, but
I can drive.
Cool.